Okay, welcome to the bridge instructional video for reversing back pain. And the way this is going to go is this is a video of me performing the bridge, and I'm going to be describing exactly what I'm doing, starting and stopping the video to make points. So the first thing you're going to do is you're going to position yourself. So lay on your back with your feet flat and your knees bent. And you're going to bend your knees as much as is comfortable. So as you can see, I have my knees my heels about 6 inches from my butt. So once you're in position, you're just going to breathe and relax into the position, and you're going to feel for your major support zones. And what I mean by that is the areas of your body that are most connected with the ground, or where you feel the most pressure with the ground. And I'm going to suggest that that's likely your pelvis and your upper back. And what we're going to do is we're going to try and shift our support zones away from these two common areas and into our back anchor zone, which is right in between those two areas, and it's the bottom of your rib cage in the back. And we're going to use our abdominals to do this. So we're going to engage our abdominals and we're going to press our rib cage down into the ground, like so. And then we're going to further increase that connection by engaging our abdominals even more to unweight our pelvis. So pressing into the ground further with our back anchor zone, engaging our abdominals and lifting the pelvis up. And I'm not using my glutes right now, I'm just using my deep core muscles to pull my pubic bone up towards the sky. And once I've done that, and I can breathe into this, then I can engage my glutes and come up into full bridge. Okay, so I'm up in full bridge, continuing to breathe. I never hold my breath during this entire exercise. My rib cage remains down. Here I'm focusing on keeping my pelvis in that posterior tilted position, as opposed to the anterior tilted position that my hip flexors are trying to pull me into. So I'm imagining myself playing tug-of-war using my glutes and my abdominals to help pull my rib cage into that posterior position, or neutral. And what you just saw me do was bring my feet a little closer in. So I tend to like my feet as close in as possible, because the more your knees are bent, the more you're taking your hamstrings out of the equation. And that's a biomechanical reason that I'm not going to get into, but let's just say it puts your hamstrings at a mechanical disadvantage by shortening them, and it requires you to use your glutes more to remain in the bridge position. The other thing it does is it further lengthens your hip flexors. And you're using your glutes, you're using the opposing muscle to perform that stretch. So it's a perfect exercise. It's called active stretching versus passive stretching. If I were to just take my hand, grab my ankle, and bend my knee, yes, I'm stretching this muscle that I want to stretch, but I'm not reinforcing it by strengthening the muscle that would hold it into that lengthened position. And with passive stretching, the muscles tend to return to their original length, so they don't have long-term effects like active stretching does. And you want to be able to counter this stretch, so you want to be able to stabilize your pelvis with your glutes and your abdominals and counterbalance that force if you're going to give your hip flexors more of a stretch or come further up into the bridge. So now I'm focusing on stability. I'm breathing into my core, not allowing my pelvis to be pulled into the anterior position, and I can hold this and breathe or come back down and do repetitions. And that is the basics of the bridge.